Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Melissa Hritzik. We have plenty of medical news you can use in this episode, including soreness in the groin area could be a sign of a hernia. Coming up, you'll find out why you don't want to wait to get it checked out. A new mom is thankful her newborn twins could get specialized care they needed locally after being born early term. And you'll learn how local cardiac surgeons are able to correct a leaky heart valve using minimally invasive surgery. We begin this episode with information about a disease that is a major cause of stroke. But when diagnosed early enough, local board-certified vascular surgeons are able to treat patients.
So carotid artery disease is plaque buildup in the carotid artery, which is a large cause of ischemic strokes, where little blood clot breaks off, travels up into the brain, and then a small part of the brain can die, and that's a stroke. So if somebody has a mild blockage, 50% or less, then we're going to treat it medically. Blood thinners like aspirin or Plavix, diet modification, blood pressure, cholesterol control, stop smoking, all of those things.
Dr. Hannum says patients with more advanced blockage may be treated with surgery.
There's two treatment options in regard of surgery versus a carotid stent. Probably 95% of all advanced carotid disease is treated with surgery, a carotid endarterectomy. Open up the artery the long way and literally peel out the plaque. Sew the artery back together, close the skin. A stent would go through the groin, needle procedure, come up to the neck, inject some contrast, take a picture of it, look and put a stent in there and expand the blockage. That is typically only 5% of the patients, and they're usually because they're over 80 years of age, bad heart condition that makes them not a very good choice for surgery.
Dr. Hannum says carotid artery disease is asymptomatic, but a primary care physician can potentially detect the deadly disease.
The vast majority, it's picked up by their primary care doctor. They hear what's called a bruit. They listen with a stethoscope, and it's just basically a swishing noise. It doesn't tell you if there's a 20% blockage or a 90%, but if there's noise, then they will typically get an ultrasound of the carotid artery, and that will give a pretty good idea of is it small, medium, or large problem. And then we can do other tests, MRA or CTA after that if needed.
From the pipes in our body to the pump that ensures blood flows throughout. In our next story, a local cardiovascular surgeon explains how minimally invasive surgery can correct leaky mitral valves.
In all forms of leaky mitral valves, the basic problem is that as the heart tries to pump blood out to the body, it's leaking backwards through this valve towards the lungs. The lungs fill up with fluid, and the general symptom for almost all leaky mitral valves is shortness of breath. The problem with this is that the heart struggles enormously to circulate blood when it's all leaking backwards, and eventually the heart failure will get worse and patients will begin developing much more significant heart failure. It used to be that we only operated on patients with leaky mitral valves when they were in severe congestive heart failure. Then we started operating on patients who were having symptoms with exercise. And now we are recommending that patients with severe leakage of their mitral valve get treated even before they develop symptoms. And we do that because, number one, the patient is going to be a lot healthier and tolerate the surgery a lot better. But number two, it's much more likely that we're going to be able to repair the valve before it degenerates too much further. And thirdly, by the time they develop symptoms, some of the changes in their heart, some of the weakness may be permanent and not resolve.
Dr. Moore says seeing a primary care physician regularly can help identify the condition.
Patients with mitral regurgitation, even without symptoms, generally will have a murmur. A murmur is turbulent blood flow through this leaky heart valve, and that's picked up on physical examination, and then the usual next diagnostic step is to do an echocardiogram or an ultrasound of the heart to take a look at the heart valve.
You'll find resources to help with cardiac and vascular conditions by visiting fhwatermanheart.com. Next, we turn our attention to moms and how local obstetricians prepare their patients for multi-gestational birth.
I thought it was a joke. I would have thought my kids would have had twins before I did.
Larissa Wright of Eustis already had 4 boys under the age of 9 when she got the news.
It took me to about 30 weeks to really realize I was having twins. Not realize, but to let it sink in fully.
Wright's doctors, Mamie Rogers in Maryland, Maine, made sure she was ready.
When there's multiple gestation, it usually requires more frequent visits just so that we can monitor growth, we can monitor preterm labor symptoms, and also monitor any potential complications with the mother. Pregnancy, that consists of multiple gestations is automatically kind of a high-risk situation for both mom and for babies. Some of the things that we worry about is preterm birth and preterm delivery, preterm contractions, in the mom as well. We also worry about some potential complications in babies in terms of how they grow, whether or not they're getting enough nutrients from the placenta.
The first thing they told me was my high risk was going to be reduced a whole lot, just for the simple fact that they each had their own placenta and their own amniotic sac. So that was a huge plus and a big relief off of my shoulders.
As a precaution, Wright also saw a high-risk specialist in Orlando. But the young mother was determined to have her babies at Florida Hospital Waterman.
I wanted to deliver here for the number one reason, and I'm extremely comfortable with Dr. Main and Dr. Rogers, just for the simple fact that I've been going to them off and on for a lot of years. At 34 weeks, at 33 or 34 weeks, we found out we were going to have to push my C-section up 2 weeks because this one in my hands, Markel, baby A wasn't growing as fast as baby B.
For a twin delivery in the operating room, we have 2 nurses to accept the babies after we deliver them. You'll have 2 respiratory technicians there also. Normally the pediatrician is there, so it's a full room. Each baby will have their own attention, make sure they're breathing right, make sure the heart rates are right. And so there's always enough nurses to take care of each of the baby.
Literally, time they came out, they were screaming to the top of their lungs. And she lifted them up, she said, "Here's baby A." And then they were only born a minute apart. We were kind of planning on them possibly having to go to the NICU because they only came out at 4 pounds. And they were the only babies on the floor out of like 10 babies that didn't have jaundice. They didn't have any breathing problems. They came out, for them to be so small, they came out literally perfectly healthy.
One of the things that I think most people in the community don't know or don't realize is you can still deliver in your community hospital, and if anything, requires a consultation, it typically is just a visit or an ultrasound with a high-risk specialist.
I honestly would recommend this hospital to anybody. I love this hospital. Funny thing is, I'm from Orlando, and I would still come to this hospital. I would still come to this hospital out of a choice of going to an Orlando hospital.
Visit fhwatermanwomen.com to learn about the specialized care available for women of all ages. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. Knowing his family history helped this local man identify a potentially deadly disease early. Stay tuned for an important reminder about men's health. That pain you feel after lifting something heavy could mean you need surgery. A local expert will talk about hernias. And we'll visit the Conry CREATION Health Center where you'll meet the kitchen team and learn a delicious meatless recipe. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery. And you'll also find a listing of the specialists featured in this month's episode. You might want to check out these upcoming community events. Don't go away. Waterman Wellness will be right back.
Now it's time for the Creation Health Tip of the Month. You can have an environment that nurtures you. Today, clear away clutter so you can enjoy your living space more fully.
Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Melissa Hritzik. June is Men's Health Month, and we turn to a simple test that can help identify potentially deadly prostate cancer. Experts say family history can be an important trigger for men to get a PSA test.
Today, with the advent of PSA, we have the opportunity to detect prostate cancer early. PSA screening isn't for everyone, but for young patients, especially with a family history of prostate cancer, once-a-year blood test and digital rectal examination to check for prostate cancer is still a good idea.
Both of my brothers have dealt with prostate cancer. I'm the youngest of three. Just based on this fact, I just assume that being that prostate cancer sometimes runs in families, and being that my older brother had a diagnosis prior to my age that I am now, I went to my doctor who does a routine physical and asked him to do a PSA to see if maybe I had something I need to be concerned about. My general practitioner found out through a PSA test that my PSA score was 4.2, which I came to understand is a little bit elevated.
Most patients undergoing prostate cancer screening, it really is a quick examination. It's a simple blood test as well as an exam. That exam is very well tolerated and for most people quickly forgotten.
Dr. Gerbach conducted more tests and identified cancer in Spadaro's prostate. After surgery, the Florida Hospital Waterman medical team prescribed radiation therapy to ensure Spadaro's cancer was gone.
The whole process for me here at the facility that I'm at Waterman has been very good. It's been positive. And the biggest part of it has been the people that I've been dealing with. I was a firefighter for 34 years. Being a firefighter is very empowering. We are portrayed in the media as being super guys. I got knocked off my pedestal big time with this problem because it made me very mortal. You know, you got to pay attention to what your family history is, and if you have any indication at all that things aren't right in reference to cancer, you need to get it checked out. You just have to, for your own good.
You can contact a cancer care navigator to answer your questions and provide local resources at the website on your screen. Next, a Lake County surgeon wants to make sure men and women recognize a common condition that can come about in an instant. She says if you're feeling discomfort in the groin area, it could be a hernia. And if not repaired, it may lead to serious health problems.
The presentation of a hernia can be quite varied. An early phase of a hernia tends to be actually more painful, but less obvious in terms of what you can feel or you can see. Some people do have that classic presentation where they lift something heavy, they feel a pop in their groin, they take a look down there and there's a bulge and it hurts, and they go to their doctor. Yes, they do have a hernia. The reason that we need to at least diagnose and potentially fix hernias is because hernias are just essentially a break in what we call the abdominal wall. There's a lot of areas where you have weaknesses in there and you can form hernias, and the groin is one of the more common ones, particularly in males. The issue is that things that normally belong inside your belly can sometimes come out of that hole and get stuck out. And particularly if it's a piece of bowel that gets stuck out, you can get quite sick from that if left untreated. So if you do have a concern, seeing your primary care doctor and possibly getting a referral to a surgeon if it is indeed suspicious is something that's important to do.
Hernias can be treated with a minimally invasive outpatient procedure. You'll find local board-certified general surgeons to assist with treating a hernia by visiting fhwaterman.com. Next, we visit the Conry CREATION Health Center kitchen, where Caroline Rowland and the Florida Hospital Waterman team have a meatless recipe that may fool your cravings for beef.
You might be looking for some healthier options to cook for your family this summer and some alternatives to red meat. And today we have some options for you right now. We're joined with Florida Hospital Waterman Executive Chef Fred Schrager and registered dietitian Mara Gallo, who's going to tell us a little bit how we can make fungi tasty. So Mara, what are we cooking today?
Today we're making a portobello stuffed mushroom. It's a good alternative to red meat this season.
And you were telling me a little bit about how it's good for lowering your sodium intake.
It is. Mushrooms are very high in potassium, and potassium tends to counteract the effects of sodium on blood pressure. And so by eating more mushrooms and incorporating them in our diet, people at risk for hypertension can reduce their risk.
Great, so Chef Fred, tell me a little bit about what's going into this.
Okay, so here we have a beautiful portobello mushroom. It'll be stuffed with fresh garlic, fresh shallots, brown rice, feta cheese, pine nuts, salt-free seasoning, fresh spinach, and finishing with a little bit of lemon juice.
Great, let's get started.
Awesome. So take this beautiful portobello mushroom, and what we want to do is we want to just take a brush and oil the outside, and we're oiling at the outside so that the mushroom does not stick, and then helps it not stick to the pan. Next, we want to make sure that we're going to saute our ingredients. We're going to start with adding the remainder of the olive oil into the pan. We want to make sure that we get that a little bit hot. We want to make sure that we coat the pan evenly with the olive oil before adding our ingredients. So we'll start a little bit here with fresh garlic, fresh shallots, and what we want to do is make sure that we cook this until we're sweating the flavors here of the shallots and the fresh garlic. Make sure that they get clear in color or translucent. So we'll get that going there. Next, we want to add our fresh spinach, and we just want to make sure that we get it all in there. Next, we want to add our brown rice and be able to heat that up. Pine nuts will give it a nice nutty aroma and a good flavor. And the cheese will kind of bind that together. We'll add our salt-free seasoning. Lastly, a little squirt of lemon, so that lemon juice will flavor that perfectly. And I think our stuffing is ready to put into the mushroom, and then we're ready to go into the oven. Now we'll take our stuffed portobello mushroom and we'll put that in the oven. Make sure our oven's set at 350, and you want to cook that for about 15 to 20 minutes. Now our portobello mushroom is done. What you want to look for is a nice browning crust and melted cheese. And we'll get that right on the plate there.
Looks delicious.
Looks delicious, doesn't it? Yep.
You'll find the recipe for the stuffed portobello mushroom by visiting watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Melissa Huritzek for the award-winning Waterman Wellness.